Now let's look at the fixed oxygen concentration devices, also known as high-flow devices. These provide sufficient flow of gas to meet all the patient's minute ventilation requirements. Firstly, why would you use a fixed oxygen concentration device? These devices might be more appropriate for patients with chronic lung disease and CO2 retention, whose ventilation is dependent on hypoxic drive. This is an overemphasized condition where the usual stimulus for respiration, which is the maintenance of normal CO2 levels, is lost due to chronically high carbon dioxide levels. Respiration is then driven by hypoxia. If high concentrations of oxygen are given to these patients and their PaO2 increases, this hypoxic respiratory drive can be lost. Hyperventilation may occur and the CO2 will become very high, causing coma and possibly death. A high-flow device, in which the oxygen concentration can be carefully controlled and guided by blood gas measurements, is more appropriate for these patients. The inspired oxygen concentration is determined by the design of the device and not by the patient's rate and depth of breathing. This is because Venturi devices accurately deliver predetermined oxygen concentrations at flows that are high enough to meet the inspiratory flow rates of most adult patients. The gas flow to the patient is increased by entraining air into the device using the Venturi effect. Accurate oxygen concentrations are delivered by the mixing of entrained air and oxygen. Masks are available with interchangeable, colour-coded Venturi valves for different oxygen concentrations, for example 35%. When using a Venturi mask, select a Venturi valve of the prescribed oxygen concentration and attach it to the mask. Attach one end of the oxygen tubing to the valve spigot and the other end to the oxygen flow meter. Set the flow meter to the flow indicated on the valve. Place the mask over the patient's nose and mouth to obtain a secure and comfortable fit. It is important to be aware that at oxygen requirements above 40%, the valve may not generate enough total flow to meet high inspiratory demands. There is also a widespread misconception that the oxygen concentration varies with the oxygen flow rate. If the oxygen flow rate is increased, the total flow to the patient is increased, but the oxygen concentration stays the same. For example, the recommended flow rate for a 35% Venturi valve is 8 litres per minute. This delivers to the patient a flow rate of 45 litres per minute and an oxygen concentration of 35%. Increasing the flow rate to 10 litres per minute increases the total flow to the patient, but the oxygen concentration delivered remains at 35%.